Those who've experienced whooping cough as an adult or witnessed a child suffering from the disease will know how scary it can be. It's most serious for newborns who can't begin the course of vaccinations against the disease until they're 6 weeks old. But doctors and some parents' groups say there is a way to protect them, and they're calling on health authorities to trial the whooping cough vaccine on pregnant mothers in order to immunise babies in the womb. Josh Bavis reports.
There we go.
Okay. It's okay.
You cough so hard, you can feel your face turn red and it feels like your eyes are going to pop.
Okay.
They get an awful cough, they can turn blue, they can have periods where they stop breathing.
Okay, take a breath, Melanie. Come on. Almost.
The deadly bacteria Bordetella pertussis, or whooping cough, infects about 16 million people around the world every year. It kills almost 200,000 children.
There we go. Oh my.
It's particularly dangerous for babies under the age of 6 months, where 1 in every 200 babies that gets infected can die from the infection.
No, then you well and truly better look.
12 years ago, Kathy McGrath didn't realise the seriousness of the disease. That was before it affected her family.
Mulberry stains all over your lips. I first became really aware of the illness when my cousin lost her newborn baby to it in 2002. And at the time, I just thought it was one of those rare things that happened, you know.
Then it struck again. Her daughter, Erin McGrath, is now a healthy 7-year-old, but just before her 3rd birthday, she contracted the disease despite being vaccinated.
She started the cough, the characteristic whooping sound after she'd basically cough, 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 hoop, and then she'd vomit. And she would do that on an hourly basis. I was so frightened I took her up to the nearest hospital.
Then, 5 months later, at the worst possible time, Kathy McGrath, who'd delayed a booster shot, also fell ill.
When my 3rd daughter was born, I caught it, and it hit me so hard how close I came to catching it, passing it to my newborn, and how the story could have been so much different.
In Australia, infants can only be vaccinated at 6 weeks, leaving a window of vulnerability. In the last 14 years, 6 Queensland babies have died from the disease, all under the age of 2 months.
Babies aren't properly protected until they've at least had 2 and really 3 doses of the vaccine. And so in those first 3 to 4 months of age, the protection they get is what comes through the placenta from their mother.
The idea of immunising the baby in the womb sparked a trial in the UK about 2 years ago where pregnant women in their 3rd trimester were vaccinated. More than 80,000 British women have since received the shot, passing on the immunity to their unborn babies. Doctors say the results are encouraging.
They suggest for the first 3 months of life for a baby, the effectiveness is about 93%. We're expecting those results to be published soon in a journal where they can be looked at and reviewed.
It's also been used in the US and New Zealand, and there's a growing push for Australian authorities to get on board. A small clinical trial is underway in Melbourne. Researchers are comparing those results with the cocooning method, where the baby's family and friends are immunised.
These strategies appear to be worthwhile strategies. They don't appear to have the same effectiveness as the antenatal or pregnancy vaccination strategy.
Like most vaccines, it doesn't guarantee full protection and it wears off over time. It's also combined with diphtheria, tetanus and polio, but doctors argue it's still the single most effective method of protection.
I think it's beneficial for anywhere, and it would be lovely to have it here in Queensland.
But after years of debate about vaccinations, administering the injection to pregnant women could be a tough sell.
It'll get progressively harder as the weeks go on.
I don't know anything about it, so I'd probably want
more information.
I'd definitely consider it because I'm a big believer in terms of immunisations for children and adults, etc.
I've already got a 2-year-old, so I wouldn't want either of my children to have it, and if my doctor recommended it, I would have it.
What sort of guarantees or support could you give to pregnant women who might even be scared to take a Panadol, for instance?
Well, the research has shown that it's very, very safe, and the fact is that what you're actually doing is protecting the baby, and you're never going to harm the child by doing the immunisation.
There's a long history of vaccination in pregnancy. For example, we know that influenza vaccine, which is recommended by the World Health Organization, protects not only mothers but also babies in the first 6 months of life from serious illness.
The number of whooping cough cases in the state peaked at almost 9,000 in 2011, but have since dropped. But pro-vaccination campaigner and pregnant mother FIONA SUGDEN says there should be no room for complacency.
Look, as a mum, I've got 3 other children, they're fully immunised. I will be absolutely ensuring that if I have the ability to get this immunisation here in Australia, I will be getting it.
The AMAQ says if the antenatal vaccine is introduced in Queensland, it should be free.
That means the take-up's a lot better, because unfortunately there are people in our society who cannot afford some of these things.
If I had had this opportunity when I was pregnant, I would have grabbed it.
And the Queensland Government is working on a new immunisation strategy expected to be released next week.